Minister, although I have personally wished you well, I do wish you well in, indeed, as Deputy O'Leary said, what is an unenviable portfolio. But Minister, because of years of underinvestment, and I want to use the word investment, because after all, the outcomes of early intervention and successful mental health treatment is an investment in as much as education is in the country. But Ireland's mental health system has already been under immense pressure because of the lack of investment. Before this pandemic, and now services are stretched even more. Our communities are in dire need of funding or investment to support them through this tough time. And I know that the government is putting together a budget, and I know that you will have influence in that, not just because you're a minister, but because you're a woman. And I don't care who hears me saying it. I believe women work differently. And I believe that women know how to impress what the real serious issues are. But I want you to remember that for every number and statistic that's quoted in this House tonight, there is a person. It's a child, it's a brother, it's a sister, it's a mother, it's a father, a grandparent. Not just a number. And that's what worries me about the statistics. 1,020 children on a waiting list, but they are all brothers and sisters of somebody. What you do will affect all of those people that we know and love. And the mental health reform, the national coalition of 70+ organisations have launched their pre-budget submission and sent it to every TD in this House. And it states that there are less staff now in the system than there was in 2008, and yet mental health is at an epidemic level, and worse it's going to get because of the pandemic. Not just the pandemic, but it is going to get worse. We need an out-of-hours service, not just in Wexford. It appears from all of the deputies all over the country. But a 24-hour crisis service to give people at risk a proper chance of survival, which allows their close family and loved ones with no expertise in how to cope with these situations, assurances that there is help at hand, a service that lets them know that as politicians we have their back. We as politicians understand that the risk of suicide or mental health patients is grave, and we need a 24-hour service that can distinguish care differentials between adults and children. As it stands, many communities depend greatly on voluntary organisational services, and one such service that I can't speak highly enough of in County Wexford is Marine Watch. This service patrols Wexford Bridge on a nightly basis to prevent the loss of life, and no amount of gratitude from me or the public would suffice to express the value of what these people do. And I sincerely hope that the support and services of voluntary sector organisations like this won't go unnoticed when it comes to the Department and the Government putting a budget together for 2021. The Mental Health Reform Commission says that we need at least the Mental Health Reform Commission says that we need at least an additional 80 million put into our mental health services. And again, I call that an investment. The services it's 80 million that's needed as an immediate measure to allow for the increase of mental health patients and issues that have arisen during COVID. But if there's any doubt about the funding of these services, well, let me tell you what can be achieved and the good news story that you're looking for here this evening. It isn't all doom and gloom. I've had numerous phone calls from parents whose children have gone through the Leaving Cert, but only because they were lucky enough to access services at a time when their children needed intervention to deal with mental health issues, and that if they were left untreated, they might not have been able to complete the Leaving Cert. As it stands, they got that treatment and they are now applying for college places. There are those who are applying to join organisations and start careers that they never thought they would have because of their poor mental health. The point, Minister, is that the mental health services work. but when they can be accessed. And there are good news stories of achievement and survival, but the problem is accessibility and availability. I don't accept that it's just a financial deficit. I have recently written to you, and you'll be aware of it, about a vacant position for a child psychologist for the CAMHS unit in Wexford. And whilst I do thank you for a very prompt response, I absolutely do not accept the answer was a HR issue. Under any circumstances, and I won't quote the circumstances because they are in themselves quite devastating, but if it was the private sector, it would actually be a legal matter, I would imagine. And I will have to take that up again. And I think if the impediment to a child psychologist is a HR issue, and Wexford CAMHS unit is without a child psychologist, and there is no other applicant, I think it would be fundamental to the success of CAMHS in Wexford that child psychologist would be appointed, and that we could get over the HR issue in order to save lives. And I hope, and I think we will take that up again. But the system is archaic in taking that approach, and I think we have to restore the faith of the people in Wexford and the government, and have the staff requirements fulfilled in the CAMHS unit in Wexford, because it's ongoing for years. And if we have one applicant who wants to take up the position of child psychologist, and we're being told there's no funding issue, how can we say no to this qualified person who has held the position before? But finally, Minister, and I think you may be the first Minister for Health that I am aware of, and you're my close neighbour in Waterford, so it will be a trip over Passage East car ferry. I want you to visit the unit in Wexford. I think it's the least that the staff who are under severe pressure deserve, is a visit from the Minister, and they can inform you firsthand. I don't expect it to be next week, I don't expect it to be the week after, but I really believe that you need to come and see that unit. And thank you for listening to me. I think it's devastating to hear that we believe what we're listening to tonight from every TD now appears just to be rhetoric. Well, it isn't rhetoric. Mental health and our elder people in society are as close as it comes to the education of society. Thank you.
Thank you very much.